Right. Hello, everyone. Welcome to EYEJ's Digital Inclusion Week event, Making Connections and Closing the Digital Divide. My name is Mallory, and I'm a part of the EYEJ Youth Council. I am 20 years old, and I am from Slavic Village. Today, I will be speaking with Paige Anderson. Paige, can you introduce yourself?
Hi, my name is Paige Anderson. I went to Shaker Heights High School and I graduated in 2016. I recently graduated from Wellesley College with a bachelor's degree in economics this past May of 2020. And currently I am interning as a marketing intern for Crest Health and a content and marketing intern for Cherish. And I'm also creating a podcast through the Creator Institute that will be published in April 2021 that deals with hopeful stories from COVID-19.
Very nice to meet you, and thanks for speaking with me today. We're going to be talking about telehealth and the digital divide. Telehealth is a fairly new concept that has become increasingly popular during the current COVID pandemic. Could you tell me more about what telehealth is and all that it entails?
So I can't give a medical definition on telehealth because that's not my background, but to me, telehealth means connection. Right now, especially during the COVID crisis, we are encountering a lot of uncertainty. There were a couple studies released from China and Italy about how healthcare workers have felt more stress levels, more anxiety, and more depression because they're uncertain about how to tell their patients about COVID. And they feel more uncertain about how to treat COVID because we don't know that much about it right now. Obviously, like people from all walks of life, whether they're adults or teenagers or children, are having to adjust to this online classroom situation that they're not used to. They're having to miss their milestones. And so to me, telehealth is the ability to still find that connection within the uncertainty, whether it's through online support groups, whether it's through like Zoom meetings, for example, just being able to talk about your problems, talk about them, and try to come up with different solutions within each other, or even just trying to relate to one another. That to me is what telehealth is.
I definitely agree. Like during this pandemic, it was a very brand new thing to me, and I didn't realize when I had I have an app to help me with like my mental health or connect with a therapist, and it didn't occur to me that that's something that could be considered telehealth and how important that actually is to have access.
Yeah, definitely. I mean, I just want to clarify before speaking further that I'm speaking on behalf of myself and not for the organizations which I'm interning for. But I think that what they're doing too, so with Crest Health, they're trying to create a space where healthcare workers can talk to one another. And with Cheris, we're trying to create posts that talk about how how parents can use techniques to help teens get through problems associated with COVID-19. That's so important right now. And it's so important to find that you're not alone in those struggles and that it's okay to not know, that there are a lot of people in the same situation, that none of us have the answers at the moment.
Yeah, that actually ties into my next question. With everything going on right now with COVID-19, many people have been turning to these online resources. What has been your experience during this pandemic, and have you noticed a shift to virtual resources?
Yeah, definitely. So back in March, we were all forced to go home due to the pandemic. And so before at Wellesley, we had no online classes whatsoever. Obviously, we all met in person. We met in person for office hours, but during this COVID crisis, we had to completely switch to online resources. Also, just from my own personal experience, when I went to the doctor's office, I've never had to, do it virtually. But when I had to schedule a doctor's appointment, I had to try and, point out like physical symptoms with my doctor, which is obviously like a little more difficult to do. And actually, Crest Health was founded during COVID. So Crest Health did not exist beforehand. The founders decided to create it because they found that healthcare workers were struggling, that they needed help and they needed some form of assistance. And so they're trying to like step in and create this like a portal for them to like talk about their struggles.
Yeah, definitely. And not even like in my personal experience, it hasn't even just been for like care or reaching out has been my college. I go to the Cleveland Institute of Art, and we are trying our best to keep everyone safe. And one of our ways to monitor COVID symptoms and help decrease the spread is that we have an app called Campus Clear. And basically, every morning that we have to log in the building, we have to get into the building, we have to log into the app and select what symptoms that we have and show it when we walk in the building to make sure that we're healthy. And if we're not, my school tries to help us as much as possible.
Yeah, and that's so important because you have to resume in some way, like going back to normal, but you also have to do it in a way where you're not risking the lives of others, especially the lives of like older people and people with pre-existing conditions, which, as we know, can are more likely to die from COVID. So that's really good that your school's doing that. Personally, I have not had that experience yet. All of my internships have been online, so I haven't had to like go in person to check in anywhere.
Earlier this week, we also heard from Budu Bingay, an epidemiologist using data and digital access to track COVID-19 in New Hampshire. It was clear that much of his work would be impossible, or at least incredibly difficult, without digital access. How do you feel about digital inequality that's impacting our health outcomes, especially in Cleveland?
So I can't speak on behalf of Cleveland because I don't have the statistics, but unfortunately, there are parts of the country that don't have access to broadband internet, which is, it seems like unbelievable in, the US, which is considered a developed country. But it can definitely create those inequalities where if you don't even have access to a phone, where you don't even have access to the internet or at least data, how are you going to, talk to an online therapist? How are you going to find people and support groups to connect with? How are you going to find, posts that maybe, the answer that you're looking for, at least may help you find the answer you're looking for a problem that's occurring at home? So I think it's very unfortunate that those problems still exist. And I hope that at least through like COVID can help us prioritize access to broadband internet, not only, in the US, but throughout the world too, because inevitably the world is becoming more digital. So I hope that's a problem that's addressed soon.
Yeah, definitely. It's no longer a luxury, it is a necessity. I totally agree.
Exactly, especially with online classes. You can't even, you can't even attend the class without the internet nowadays. So I definitely agree.
Connectivity has been extremely important over the last few months. Unfortunately, I think the current situation has also highlighted inequity in digital access. So during the pandemic, I had like issues with my computer dying. It was very difficult to stay connected in my online classes. Like so many of my other, uh, it's just so much went on that was. Luckily, the teachers understood. If we had technical difficulties, they were like, if we got knocked out of class or something, they wouldn't like say that we tried to leave class or something. They understand how difficult Wi-Fi can be. It took me a while to upload assignments and stuff, so it was a learning curve, and it was definitely a different experience to get through. But my mental health definitely struggled. It was something that I had to work through, and I'm glad that I can healthily be outside with people again, and that we're getting through this as a community and as a country and stuff.
Yeah, I definitely think teachers need to be more understanding towards students like who need help with like technology or just don't have the same access as like students who have the privilege to be able to be in like a stable like home and to have access to internet all the time. So I've heard stories where teachers aren't as understanding towards students about submitting assignments on time, and that's just unfortunate. I don't agree with that whatsoever. It was just such a quick change that there wasn't much like training, or there wasn't like at least a gap in between for us to prepare for. So at least your teachers were understanding, but I definitely think that there should at least be like more resources available, more training available for people who will encounter those problems more often.
Yeah, and like I was talking about how I knew how it was affecting other people. One of my peers during our town hall, when we were talking about the digital divide, her family struggled a lot with receiving health care when they were ill during the pandemic because they didn't have any internet access. She couldn't, make appointments. She was actually misdiagnosed with some of her symptoms. Um, Telehealth has been an incredible savior for some during this time, but it's important to recognize that some are being left behind because of the digital divide.
But then we haven't even like touched upon the topic of how like this because we don't have access to like a single payer form of healthcare, that because of that like our healthcare is just much more expensive than it is in like other developed countries, and how unfair that is because a lot of people are struggling. Like unemployment levels are still like much higher than they were in March. There's like people have encountered problems with trying to get like unemployment benefits. It's like this is just an additional stressor that should not even be existing during this time because so many people are struggling.
Yeah, could you speak to some of the trends in telehealth which may impact the residents of Cleveland, and what are telehealth companies doing to ensure they're being more equitable?
So I can't speak upon like different companies, but I think the use of social media with like conveying points around, you know, uh, like mental health will, I assure will like definite. Well, I am sure that it will definitely increase, where it's not so much that you can go through it word of mouth anymore because contracting COVID might be a little risky. So I think we're going to see more social media usage. I wouldn't be surprised if there was an increase in like support groups. I wouldn't be surprised if there were more apps developed that would let people get access to like therapists or help digitally. Just based upon what I'm experiencing, based upon my experience with Crest Health, where that was created during the COVID crisis, and how we've noticed that during times of trouble, there have been like startups or businesses that have been created, as a result of something, like like as a result of a gap um, that needs to be addressed.
Yeah, and speaking of social media, like I think that's one of the main driving forces that helps our youth council and EYEJ to really spread the word about this digital divide with awareness. I do think it's kind of ironic that we're spreading awareness about lack of internet through the internet, but it helps other people understand because a lot of people like, they don't even realize that this is an issue. But like it was nice to reach out to people that do understand. Like we had a phone zap event where we contacted local officials in our area to try to get their support and to understand like this is a real issue that's really plaguing Cleveland at the moment. And I actually got Stephanie House's assistant on the phone, and they were like, "Oh yeah, this is definitely something that she believes in, and she's fighting for." So that just it gave me a sense of like uh, not that we're doing the, that we're getting through to people, that this will get remedied soon.
Yeah, I would just say like keep pushing. Like as long as people are aware that you're fighting for this cause and that the topic is on their mind, then they're more likely to push like bills or like amendments that are going to help that. But yeah, I mean, I think it is ironic that the event is like about closing the digital divide, but hopefully it does allow you to help reach a broader audience, and those audience members can share with people in their network who maybe don't have access to good internet about like the things that they've learned and the things that they can try to implement.
Yeah, definitely. What resources are available for poorer communities in Cleveland that are in need of telehealth services, but due to connectivity issues are unable to access it? And how can young people use their voices and take action in support of a better connectivity across the city, and also ensure that low income areas have access to telehealth?
Unfortunately, I'm not sure if I can answer that first point. I wish I had the answer. But I would just say, just keep doing what you're doing. Just like I said, talking to officials and letting them know that this is an issue, and like lobbying on not lobbying in like the bad connotation, but lobbying in the good connotation. On behalf of this.
Yeah, definitely. The EYEJ Youth Council and EYEJ is going to continue to fight the big fight and close the digital gap. Like, we will have connectivity for all. We're determined to have that. Before we wrap up, do you have any questions for me?
What have you learned so far? Like, what are something really interesting that you've learned?
That is a really good question. Something interesting that I've learned. Well, when we were given the statistics, I couldn't actually believe it, like how 25,000 youth in the city of Cleveland do not have access to internet or devices. And that was like a really shockingly large statistic. And it's just that like how I was saying before, a lot of people like don't even realize that that's an issue. And when you don't have access to internet, like I got internet when I was in my mid-teens, so I didn't realize that there was a lot out there that I was missing, or that like I was capable of doing with the internet. Now I could look up bus routes, or I can get like these therapy apps, or like order food. There's like so much out there I didn't even realize about. So is it this lack of what I learned is that there is a lack of knowledge about how big the digital divide is, and what it can cause. Yeah.
Yeah, I mean, that number is shocking to me too. And I've lived, in Shaker, which is, I'm sure you're aware, 20 minutes away from Cleveland since I was 6 years old. Like, that's really shocking for me to hear too.
Thank you so much for your time today. I had a great time speaking with you and learning more about telehealth and the digital divide.
Yeah, no problem. Thanks for having me.
I would also like to thank our audience on Facebook Live right now. Tomorrow at 6 p.m. Eastern, we will have a speaker named Mark Comanducci of the 305 Education Group, and another speaker named Jessica Cohen from Verizon. And they will be chatting with Youth Council member Avery Allison regarding education in the digital divide. We hope to see you all there, and have a great evening.